chatted that she can hear us but can't talk.
Oh,
Could someone facilitate for a while? That won't be me, but who would like to facilitate?
Oh, I'll do it. But I think we ought to help Adrian get back in, and I was just about ready to ask Victoria what her new email is. But so stick it, if you can get to the chat or sometime, give me your new email, Victoria.
yeah, I will.
All right,
Yeah.
we've got 11 people on the Zoom, and Adrian had, oh, there she is.
I think I might, can you hear me? I think I might have fixed it.
I think we can hear you. Yes.
It's a good thing Victoria had so many problems because it made me fix mine. It's good.
Okay, well, you're on now, and I'll relinquish my.
Well, thank you. Thank you for stepping up. So what's our agenda today? What's on your minds, everyone?
Well, you asked that I have Milo Chapman here, who's our housing navigator, to talk for 5 or 10 minutes about his process through which he helps people without homes find homes. And so Milo is actually in the building working with a client, but he can join us at 10.
Great.
Okay, that's perfect. Thank you. I know we have the priority list that we built last week. I think it was just last week that we did that, where we were going to talk about, we talked about what we would like to focus on in the next 6 months. So that could be a major topic. What else is on people's minds?
Well, I sent out something that I just want to mention that, will raise some opportunities, I think.
You want to, why don't you mention it now, since it's probably a short mention?
Yeah, it is. Most of you, I hope, got my notice of the Tuesday Board of Supervisors decision about where to put their offices, whether to stay where they are and whether to go downtown. And one of the reasons I sent it out is because when they make that decision, lots of other people will have other decisions to make. The city about where it's going to go, and lots of developers who are trying to figure out whether or not downtown's going to actually happen. And so because there'll be spaces opening up, people will be saying, oh, geez, now I can maybe think about leasing you something for a year because I'm not going to use it because they're not going downtown. Or, gee, I've got some space out here that I was thinking of developing, but I'm not gonna because of whatever. So I'm just saying there'll be a cascade of opportunities that come about for commercial with parking, especially, that may come about as a result of the meeting on Tuesday. So that's why we're interested in it, in whatever way it goes.
Yeah, thank you. That's helpful. Someone is here on the phone at 541-8357.
That's Victoria.
That's Victoria.
It's Victoria, of course. Thank you.
Yeah. I had an idea that has blossomed due to my change in residence, and I'm noticing the character of homeless existence is changing. They're not congregating in the big groups that call attention. I'm noticing. I might be wrong.
Well, I think the police have definitely been telling people not to do that and harassing them when they do. So I'm not surprised you're noticing it.
Yeah, but I know of a small group of about 6 or 7 people. And I don't know, if we should, it would have to be confidential if we documented where the small encampments were, so that we're not putting the finger on them.
Right.
But at the same time, I wanted to refer those providing services to this particular group. And it just made me think of how many other little that we notice when we're driving, that there's 3 people or something, or sometimes it's only 1, or you don't know because all you see is the covering. You don't see the people.
Right. Well, I would say, definitely say to send it to me and I will pass it on to the Saves outreach workers. I know on Monday they have 100 meals that's provided by the Love Kitchen. And sometimes they have a hard time finding 100 people while the meal is hot. So Teddy, did I see your hand?
I was going to say, it's a little dated, but I have the census tract data for the past 3 years that we submitted pit counts. So it's in a raw data format, but you might be able to tell where people were shifting in the county. It's just head counts by census tract for like 2019 going back, I think 3 years. I don't know if it's too
Trying
old.
to figure that out for Sebastopol because the count of the official homeless point in time count said there were so many people, you know, this number in Sebastopol, this number in the unincorporated Sebastopol, but none of the activists there could find all those people or even anywhere close.
They were trying to plead the case for navigation centers in these areas, so they cooked some of the numbers. That happened in Cloverdale as well, and there was actually a HUD a complaint leveled to the field office about sending some of the counting people out to the coast who were supposed to do the downtown area of Cloverdale, and it was taken over by staff. So then all of a sudden the numbers in Cloverdale jumped. But anyway, they would have had to report through hashtagging the raw data, and I have it if you guys want it.
I think I'd like to see it.
Okay.
So let's do a few more updates. We have Morris Street from Suzanne. I know some good things are happening there, I believe.
Should I do it now?
Yeah, now.
Okay, there's I just got off a phone call with Cheryl Rood, who is, I think, so highly of her, and we touch base sometimes. Anyway, there is coronavirus. Apparently, she said in all the encampments in the county, but definitely on Morris Street. The testing that was, she didn't have everyone tested, but the one she could find. And some may have been from in the past, you know, that they'd recovered. Some people are still, they're recovering. She said, nobody, I haven't seen them, but she didn't mention anything of people needing further care. I mentioned, of course, the vaccine, and that maybe there's a number of people there who did not want vaccine in the past, but I think they need to be approached again, and I'm willing to do that actually. She said she could bring someone to give the vaccines. I said, could it be Pfizer instead of Johnson & Johnson? And she said, yes. No, I don't, I believe her actually. The other thing I brought up is the same thing that I have brought up other times, is the hand washing. There is nowhere, well, anyway, Cheryl has a temporary solution. She has, I think she said it was 50-gallon container at her place that can be filled with water, not for drinking, but I'm very concerned that I could mention a person or two's name, but I'm not going to. But some have a lot of people come in their trailers and can, you know, one woman lets people come and they can make toast, whatever, when she's not there. I'm pretty sure that some people, if somebody's eating, has a meal that they're eating and they don't finish it, if it was me, for instance, and I was hungry, I might just say, oh, well, I'll have the rest of that. and eat it off the same plate. I'll bet you that that's happening. I think the sanitation is a really, really big deal there. And yes, we're lucky to have no sweep happening there, but we've got to do everything we can for those people. I'm trying to think what else. Unless she changes her mind, Barbara Renzullo is going to come with me tomorrow around, I think, 4:30, and we'll do just a very socially distant with our masks and everything, a brief screening of, are you feeling sick these days? No, well, I know of specific people, and Cheryl and I talked about it, she knew of them too, who have things that, one person needs transportation to San Francisco for a surgery that, he just needs it. And who's going to drive him there? I'm not, but maybe we can figure something out. And there's others who it's obvious to me, even though I'm not employed as a nurse, I still have my RN. I recognize stuff in people that they need to be talking to their doctor. Maybe I need to help them make an appointment, but it's serious there. And Cheryl said she'd try to come out when I'm there too. And maybe Barbara Renzullo will still come. I will wear a mask. That's it for me.
Thank you, Suzanne.
Mhm.
I see Jerry's hand is up, and I wanted to announce that it looks like we're going to have a worker in Sebastopol.
Yes.
So,
Maybe Tim,
Suzanne,
you want to sort of make that announcement?
Am I still on?
Yeah, but I'm suggesting maybe Tim wants to say it since he's with us.
Oh, Tim, do say it. I know that we have that person on.
Thank you, Suzanne. Yes, in fact, she's sitting in our kitchen right now, filling out the paperwork. Her name's Jennifer, and she will be full-time as an outreach person, coordinating with the community, the city, law enforcement, et cetera, et cetera. We're waiting to hear back from the city. It's, as we know, government can be slow, and we appreciate though very much the funding. The MOU is with the city, and now they have to take it to the city council. They've approved the budget. Now they have to approve the MOU. So the person will start as soon as they say they've signed. And we're going to be paying her this week out of a different funding source to work at our shelter, just kind of get up to date with the West County homeless population. That's all I have to say about Sebastopol.
and Jennifer's last name?
I don't have it in front of me. It's
Okay.
Jennifer.
Thank you. So Suzanne?
Go ahead.
Adrian,
Yeah, go ahead.
so on the guy who needs to get to San Francisco, is he going to UCSF for the surgery or someplace else?
It's an aneurysm, brain aneurysm.
So is he going to, I don't
I don't know
to
if it's UCSF or not. I can
Okay,
find
just-
that out.
Okay, so for anybody, whoever has to go to UCSF, every department has a social worker. So you can always, and there's like dozens of clinics, but anybody can always contact the clinic and ask for a social worker. Those social workers can arrange for transportation, either medical transportation or bus tickets. So it's a really good resource to know about. But it's specific to any of the UC campuses.
Okay, I don't know where, but I'll find out. Thank
Okay.
you.
Yeah,
I-
that's great.
I had one more, Jerry, I don't want to interrupt you if you're okay. I had one more thing to say to make sure I relay this. Tim, I had emailed Mary Gorley, and she emailed me back. Can you hear me?
Yes.
Okay. She emailed me back and said that at the next Sebastopol City Council meeting, which is whatever the Tuesday is, maybe August 3rd or 4th, that yes, that one is approved. That one is not going to be delayed like some of the things are.
Great.
So we want her as soon as possible. And please, Tim, tell her that I really want the chance to meet her.
One of the first things we'll do is have a community meeting for that.
Thank you.
Thank you, Suzanne.
Thank you.
Eddie,
I was going to say too that a friend of mine from Spokane told me Friday that now they're getting infections within their shelter system up there. So, you know, it is spreading. I will say as well that I think I've mentioned this before, that HUD was very determined to track screening data in the HMIS going back to last June. And my understanding is nobody heard about that here. So, so I have data points if anyone wants to know for like local tracking, what HUD was interested in finding out. I've got, you know, so I can send that too if anyone's interested. But it was a little bit, again, that, you know, public health wasn't really interfacing with the homeless system of care very well here.
I assume you sent that to David and Tina, right?
David, who?
Yeah.
Dave, yes.
I don't,
Tina.
Tina, no, I don't think, no, I haven't said it to anybody because I just never get a response from anyone. So I, you know, I just give up on that kind of thing.
I think we ought to back you up and have it sent. You can send it to me and I'll send it to him.
Okay, well, or I'll just copy everybody.
Yeah, do that, please.
I'm sensitive about who I copy because I'm sensitive about who I engage in, you know, the fact that the county is not very friendly toward me anymore. So
I know, but we can't let that get in the way of getting good information to the people who need it.
yeah, okay, I'll send you guys. Yeah, there was a gentleman who ran 211 for Orange County that has held several seminars on what to track and why J&J was used in the population and getting ahead of it. And they were very, very good. So I'll send you guys that and then copy. I don't even have this new gentleman's email. So
Gregory, could you make me a co-host, please?
Oh, sure.
So since we're talking about caseworkers and paid people to help with the work we're doing, I want to introduce a new SAVES, our new SAVES outreach worker, who is, you will see her on the screen as a rainbow, because she's a rainbow of a person. There she is. This is Andrea Baker, and we just hired her. She had her first week last week. So Andrea, why don't you tell people about yourself for a few minutes?
Well, first of all, hello, Suzanne.
Hi.
Suzanne and I work together at Palm Drive. I have lived in Sonoma County for 21 years, in Forestville, in the same place. I feel blessed to be able to say that. It's a rental. Rentals are becoming more and more rare, I've noticed. I have a background, well, I'm a nurse, and my background is in psychology, and I'm continuing studies in psychology, actually. But so I have a background in both nursing and mental health, and a real desire to use those skills to help with this population. I was homeless myself as a teenager from the ages of 17 to 19, off and on. So I have lived experience as well.
Thank you.
And I'm a blank page to be written upon. So I'm looking forward to learning a great deal from all of you.
Anybody have questions or want to say something to Andrea while we have her here? Hopefully she can, drop into this meeting there every now and then. I think she's here today through the end of it. So
Yeah, I have something
Go ahead.
I would like to ask. You're taking enough precautions, right, about the COVID thing and everything?
Yes, absolutely. I've been masking. Actually, I never stopped wearing my mask. I don't believe that we should. And according to the current CDC guidelines, they're trying to urge people to wear masks again, especially indoors.
Right. Yes.
Yeah.
Yes. I'm very concerned that there isn't a whole movement to get the homeless vaccinated, because this Delta variant is scaring me.
Mhm.
Yeah.
This is Victoria, by the way.
Nice to meet you, Victoria. Yes, I know. The spread of misinformation has unfortunately been tremendous. But as Suzanne pointed out, the hygiene issues amongst the homeless that I'm seeing are tremendous in addition to the COVID spread. I was working with our other worker last week, and we actually took a gentleman to the hospital for MRSA leg wounds that
Wow.
could have been life-threatening. I have seen wounds like that go from 0 to sepsis in very little time. So it's good to have eyes on the whole person.
Yeah, for
I
sure.
just want to say welcome, Andrea.
Mhm.
We very much appreciate your work and look forward to working with you on lots of aspects of both saves and homeless action.
Thanks so much, Gregory.
Yeah, I wanted to welcome you too, Andrea. Appreciate what you said and your commitment to our people.
Thank you.
Yeah, I'm very excited to be working with Andrea. We've had a week together, and it's really, really positive. So it's a great addition to the community.
Can I ask a question, Adrian? Where is Carol's SRJC health group? You know, all the training certification that they had, and she spoke here some time ago. Where is her group? I thought they were kind of like para-population health support.
Are you saying Carol West?
Yes, I just didn't remember her name.
So they are working to, she's putting a lot of effort into getting peer workers credentialed. So people who have lived experience, especially with mental illness, can go through a training program and become a credentialed peer support worker, and theoretically in the future be getting paid for doing that work. So there's a lot of bureaucracy, and that's really what she's focused on, is trying to push through all of that stuff. I think the individuals she's been working with are a little bit splintered and not quite up and running. I mean, some of them do it on their own just by going out, meeting people and helping their friends and so on. But they're not, I did approach her, like, can we work with you? We want to, this is so exciting. We want to have people go out with our outreach workers. And she's like, I think we're not ready yet. So that's what I hear. I think we have like 6 minutes. Let's see if we can squeeze in a Guerneville park and ride before we hear from the Guerneville person. I heard things are kind of moving along there. No big changes. Is that true or false, Tim?
No, unfortunately, fortunately or unfortunately, that's false. So Friday, had a meeting at our senior center. Supervisor Hopkins, County Council, Tina Rivera, Fire Marshal, and like 7 other county folks showed up. There were about 35 people. They're closing the park and ride on August 4th. They are noticing that on July 29th. We've already told everybody there. Some people have been promised places at Los Guillicos, a few others at some of the other county sites. We do have places available at our navigation center. So August 4th, excuse me, in theory, it will be closed. At issue now, of course, is the COVID spike. They had a pop-up test site at the plaza in Guerneville this weekend, and it was 11.5% positivity rate, which is enormous.
Wow.
That was a very small sample. It was 9 out of 72 people. And so could it have been one family that got tested? I really don't know. But we don't want folks to be moving in unless it's safe. So we're working with the health center here on what the protocol is. Rapid test versus the better test that you have to wait 2 or 3 days for. I'm not sure. I leave that to the medical professionals. But that's what we're facing now. And that's where it's at. There's probably 15 to 20 people at the park and ride.
So Tim, in your estimation, with some of them going to Los Gilicos, some of them to other sites, how many people will end up just scattering or trying to go back to 3rd Street?
Some of them are very transient. They just pulled in from, Moss Landing 4 days ago. So they're just going to take off, right? But I'm just guessing, out of the 15 that are really from the area, maybe 5, 6 will go inside would be my guess. Could be more.
Yeah, you don't really know and actually until the day of, people will make their decisions at that point often. Do you know, was Amy McGraw invited to this meeting?
Yes, yeah, she was there.
Oh, great. That's helpful.
Yeah.
Okay, so kind of tough news there. I think we're ready for your person anytime you want to bring her in.
All right. Well, him, Milo.
Yeah.
I will. I'll walk down to see where he's at with the client. So just ignore
Okay.
me. Carry on.
We'll chat. I was thinking this morning, as I was preparing, that we haven't had our check-in question for quite a long time now, which I think is good. We're not spending as much time. We're more focused on the homeless thing. But I do miss hearing some of your voices. So I'm warning those of you who haven't spoken that I will try to call on you at the end of the meeting, towards the end of the meeting. So don't let those of us who have big mouths hog all the time. Come in and bring us your thoughts. And not related to what I just said, I'm calling on Gregory because I saw his hand was up.
Oh, no, I had a different, I'll wait till later.
Okay. Well, if it's something you can do in a few minutes, it looks like we've got some
Yeah,
space here.
well, it's 3 paragraphs. I need to read.
Okay.
Well, I'll do it quickly. This is a MailChimp I'm sending out to a bunch of people that basically frames a concept that I want you all to start thinking about. At a time when local decision makers are under increasing pressure to use state and federal funding for homeless facilities and services, we believe that an open discussion must occur concerning what best access, wait a minute, I gotta get closer. What best assists those on the street. In Sonoma County, successes with sanctioned villages operated by Santa Rosa and the county, tents at a local park and cabins at a converted youth camp, have opened eyes and wallets. The virus and community questioning have convinced the city to rebid the shelter contract and the Sonoma County Continuum of Care to rebid coordinated entries contractors' use of placement into shelters. Is it time to admit that safe ground, safe parking, and safe rooms are a much better set of facilities to respond to the lack of permanent housing than shelters? State funding for non-congregate single-room occupancy SRO facilities has been the standard for safe room facilities, room key and home key. Local funding for safe parking is currently being planned. The legislature just passed a large new pilot program to encourage and explore sanctioned encampments. HEAP and HAP funding from the state has failed in most attempts to build and sustain shelters. Recent housing codes and permitting to encourage small unit development, ADUs, JDUs, and federal increases in housing vouchers are opening doors from the street to permanent housing. Finally, we are finding practical solutions which respond to homeless and institutional recognize the dangers of congregate understaffed shelters. It's time for change. Anyway, that's something I'm trying to get a conversation about because I think we have an opportunity to close Sam Jones.
Go ahead, Tomas.
I want to understand, or my understanding is that SAVES is applied for a couple different programs, safe parking and programs with the county. So I'm curious, when you think we might hear or which program is the most likely?
Well, I think safe parking is going to show up before anything else, but the next home key is another opportunity, and obviously the sanction encampments next spring. So, I'm just saying the state and the feds seem to be recognizing that there are other things besides shelters. And all the money that's going from the state into opening shelters in the past seems to be failing. So I really think, we're on the beginning of about a year's worth of transition, and we need to respond.
Okay.
Milo is here.
Yeah, let's make room for Milo.
Okay.
You want to introduce Milo a little bit, Tim?
Well, I think, Milo's been with the agency, what, about 3 years?
Yeah, 3 or 4 years.
And is a long-term expert in real estate, property management, and he's such a great job. He knows everybody out here. So we brought him on with our team. It's a housing navigator, and he's done amazing work in a tough housing area. And so, Milo, we were talking about last week the different, there's some agencies that say, okay, person who has a Section 8 voucher is here's a list of houses, go look for it. But you have a different approach, if you could share that.
Yeah, what I do is I scour the internet looking for places on Craigslist and things like that, and also use my personal network of people to ask around for housing and that kind of thing. And mainly what I do is I've developed a form letter that I have I have one for people that don't have Section 8 and one for people that do. And I send those out to landlords and request them to let me send an application to them from my client. And one of the things I try to do early on with my clients is get an application filled out by them and try to make sure that it's neat and concise and understandable. Because that's a real problem with some of our folks, is to just get a good application so that the landlords will actually look at it. And then get that to the landlords and then go from there. And that's basically my approach, is to try to reach out to the landlords and express to them that we're going to be a liaison with them and the client, let them understand the services that we have, and kind of show them the advantages of working with us as opposed to just being out there on their own. So it's a kind of a two-way street for them, the client and the landlord.
And what kind of support do you provide once they find a place?
And once they find a place, what we do is we go and we do the inspection and make sure the place is actually decent. And it has to meet certain standards. And we have a standard, I think it's put out by HUD, that basically tells us all the things it has to have, like locking doors and windows, electricity that works, exits, in case there's a fire, adequate water and heat, permanent heat, can't be space heaters, and things like that. And then also, once we get that inspection done, if we find anything that needs to be repaired, we will arrange to get those repairs done. And we have incentives most of the time, depending on what our fiscal situation is, to help them with those repairs. And let the landlords know that. And that's very popular with landlords.
Mm.
And from time to time, too, I think we believe we help move them as
Yes, we help with moving expenses. And we usually follow our caseworker, Jennifer, and we usually try to keep up with the person for at least 3 or 4 months after they move in. Just call them back every month or so and see how they're doing. And if there's any issues, kind of try to work that out with the landlord. And, because sometimes the people have, there's a transition period where they're, still kind of raw from being homeless or being, couch surfing. And you got to get them to where they're comfortable talking to the landlords and not always in a state of fear of getting kicked out or whatever, because it can be really traumatic.
Yeah, go ahead, Gail.
Hey, Milo.
Hi, Gail.
I wonder what your sense of the amount of housing that's actually available compared to the number of clients that you have that could use it.
Percentage wise, I'd say there's probably there's houses on the market, but a lot of times they don't want to rent to our clients. So like when you say what's available, I say about 10% of the market is actually available to our clients. And then there's another 10% that may be persuadable. That if I talk to them and I can, actually get a conversation with them, I can show them the benefits of working with us. But so yeah, the max would be 20% of the market is actually available to our clients.
And if you could get all 20% of those, would all of your clients have a place to stay?
No. No, that would cover about, I'd say, half of our clients if we get all 20%.
Thank you.
Jerry, Teddy, and then Gregory.
Yeah, Milo, thank you very much. I have two suggestions. I'm impressed with what you're doing, and so impressed that I would strongly suggest that you actually write a research paper about what you're doing and the level of support that people need once they move into housing. I've seen a couple of reports, but a real world example of how you did what you did and the success rate, because the need, this is a different kind of transitional housing that you're doing. And so because you're transitioning people who need support once they're housed, and that would be a great contribution to the literature as well as to all of us, so we could understand what you did and how well you did it. So I think that's my first point, and I forgot my second point, so I'll come back to you.
Come back to you.
Can I, real quickly, Milo first joined us for a rapid rehousing program, and now he's using the same skill set really. In fact, the woman he was talking to earlier today is at our shelter, so you can do this for a wider range of clients. So
just a full explanation would really, because there's no, what decent literature is there about rapid rehousing, the actual program implementation? You guys have as much experience as anybody, so let's make it clear so we can propagate good practices.
Well, there's two levels that I would say. In the more urban areas like Santa Rosa, Roanoke Park, Sebastopol, you're mostly dealing with management companies, and that's a different world. I mean, they have real strict guidelines. They got to meet a certain credit score. You got to have 2 times the income to move into a place. I mean, there's all these rules that they have that it's really hard to break through those. I've had a few management companies that have felt sympathy for our clients and actually have waived some of their rules to make space for them, especially people that are Section 8, because then they realize that they're actually going to get their rent. And so it's an advantage to them. And so I sell that to them. And then private landlords are the ones that I have had the most success with. Because those folks, I can actually talk to them and appeal to their better angels. And often the way the conversation goes is they would say, well, these people have been homeless. And I say, yeah. And they say, well, this homeless thing is horrible. And they start telling me horror stories about, their encounters with homeless people. And then I kind of use that kind of like a, jujitsu and say, well, if you don't want to see that kind of thing where you live, you need to house these people. And it's incumbent on you to make that difference and to be the one that changes this. And so that has worked, and I'd say in about, 10% of the time that actually works, where they kind of, a light bulb goes off in their head and go, oh, okay, if I actually house people, there'll be less homeless people, which is what they want,
That's pretty great. Teddy.
Adrian, put me in the queue.
Sure.
Yeah, so Milo, I think you're hitting the service delivery continuum at a really great area that doesn't get acknowledged. It's rarely acknowledged is what I'll say. I have a couple of things I'll tell you, like up north, we're putting together a similar campaign right now through the Rapid Results Institute that Sonoma County went through, but didn't really seem to hear the results. And a big component of Rapid Results Institute is landlord engagement. So we're doing flyers and elevator pitches and the like right now. But the biggest component that they want to get funded is a very proactive mitigation approach, that if anything seems like it's going wrong, that the landlord has trust and confidence that they can contact the provider who did the original match and say, look, I'm not comfortable with this or whatever, but it's super proactive and way ahead of when any disputes would arise or conflicts or damage to property. So that's one aspect that they're trying to get funded. And the other thing I'll say is that anyone who wants to watch this, we did a training for this group up north about a service called Housing Problem Solving. And there were a lot of communication approaches in that video. If anyone would like to watch like proactive communication approaches I'm happy to send you the link to our training video. It's long, it's 2 hours, but right at the beginning, it is, Elaine DeColony, who ran the COC in Alameda County, goes very specifically into communication approaches with clients specifically to increase engagement. So if anyone's interested in watching that, I'll also put that down on the list, Adrian. But I think like your approach, Milo, is just so cool. And we had a group here years ago that Jerry will remember called Rent Sonoma that unfortunately never took off. And so this was kind of a function of part of the planning of Rent Sonoma as well. So congratulations.
Milo, what percent, because you've been doing this for dozens and dozens of people, what percent of landlords, after they've accepted the client, have like serious complaints about clients?
It's small. I'd say probably 5%.
Yeah.
5%. And it's usually either the landlord, a lot of times it's proximity. Like if the person lives on the property with our client, a lot of times either the landlord or the client will have some type of mental or personality conflict, depending on what their issues are, whatever person has issues. And there's only been, I've done a lot of folks, and it's only been about 4, where we've had real serious problems where the person ultimately had to move because they couldn't get along. But that's usually a mental health component to that. But one way or the other, either on the landlord side or on the client side. Sometimes.
Yeah, on both sides. Thank you. Vera has tried to get in, so I'm going to give her some time, and then Gregory and Victoria.
Are you done with it?
Mhm.
Okay.
Hi, everybody. I'm so sorry. I've got a fractured right arm. I'm in my robe, in my glasses. I was thinking I'd come on anyways and let you see me. I'm typing away. I am so inspired to hear all you talking, everything from the COVID testing to the park and ride to Jennifer Lake, now working at West County Community Services, is amazing. She's my neighbor, and she has been helping us on Friends of Fife Creek with paperwork and grant writing and stuff like that. Best she can. She's gone through a lot. This woman has the expertise to really help out here. And I can't think of a better place for her than West County Community Services. I'm really excited. I used to have West County Community Services as my nonprofit for what I do with my creek restoration and my Mermaid Festival under Bruce Alfano, who was the head of West County Community Services. And all of a sudden I was talking to Carrie, and I got really excited about possibly getting him, Carrie and Sally at Everclean North, under West County's nonprofit status like I was. And they can raise money for West County Community Services that would pay for them to do everything that they're doing, from garbage pickup to clean up around Guerneville. And let's see what else. There was somebody else that, well, Milo, you are awesome also. That is amazing what you are doing. And then I have a dear friend, I'm covering a lot, in Calistoga. I just got back 3 days from Calistoga, that's getting Hillcrest B&B taken away from them. It's been in their family since 1865, and Tubbs family. I don't know if anybody knows anything about Napa County, but 9 people are going to lose their housing. And this is all under a water rights that had gone wrong deal. And the guy that was fighting for her water rights is taking her property. His name is Grant. But I actually interviewed her on my phone, and she told me the story. And then I interviewed Randy Tubbs, and he told the story. And I interviewed a 17-year-old little girl, Faith. I sent the recordings to Adrian. But yeah, there's a lot being covered here. If anybody knows how to help this lady in Napa, I'd really like to know. I'm super excited about Jennifer again. And yeah, Tim, I'm glad you're on here. I'm glad I could get on here. I'm having to type with my left hand, which is not going very well. So anybody in the chat that I just mentioned, look at my typing, because it's taking me a lot of effort. Andrea, I'm happy about you also. And bless all of you. And I'll get back on Homeless Action to try to help I'm lamed here.
Thank you.
My
So I'm going to move on with these questions for Milo and kind of recenter us back to the information Milo's bringing. So Gregory and then Victoria.
Yeah, two opportunities, Tim and Milo. Welcome, Milo, by the way. There are two programs that I think you should try to figure out if they're helpful in gaining landlord access. And I think you guys are one of the, West County is one of the implementers of the county's rental assistance program. Is that correct, Tim? Those, there are a lot of they're having real problems trying to do that program, as you know. It's like $30 million and they haven't spent, half of it yet. Anyway, those landlords that come to that, whether or not they ever get anything and whether or not the tenant ever gets anything in combination with them, that list of landlords has to be at least half decent as possible contacts. There are people who obviously have decided the county has something for them, if only to get their rent. But I would take that list of everybody in the county and everybody in West County who tried to get some money or not. And I mean, I don't want to sacrifice the people who are in the units, but if they ever become empty, they seem like the right people to go after to try to get, more people in it. So I guess I'm advocating that you marry the two programs in some way in order to be able to locate more landlords. And the other thing I just want to mention is, when I first set up down at the People Center and at CAP, the idea that we would have a single individual pay for first, last security and problems with it, and the HCA fund was set up through CAP for that reason. I want you to be aware that, CAP still has an obligation to try to fix the problems of homeless who end up at some place and their place breaks down or their place has problems. We need to hang on to landlords, and we've done it through the HCA program by guaranteed everything possible to get people into those units. And so if I were you, I'd go talk to, Susan Cooper and say, look, we need to partner with you in the use of the HCA to get those really hard to, to fix costs that you have in your program.
Thank you.
Great, thank you. Victoria.
Yes, I wanted to ask Milo if I'm looking at the situation from a different point of view, because I have lived experience and went through a 2-year transitional program, and I ended up with permanent housing here at Bethlehem Towers. And the biggest hurdle for me was my own negativity and fatalness, because I had so many evictions and I never wanted to apply with management companies and everything. But since the Living Room Housing Navigators were helping me, they told me, do this letter, do that letter, apply here, apply there, apply here. And I was hopeless. I was in a severe depression because I thought I was going to be out on the street again. I didn't think anybody would rent to me, especially management company, which they ended up letting me in. And it's just somebody up there is pulling for me. That's all I can say, because they haven't expired and gotten off my record yet. I don't think the evictions. But anyway, I would be good for any pep talks for any clients that you have trouble with in motivation because they have this fatalistic point of view that I had.
So Victoria, are you offering to do pep talks if Milo has a client like that?
Yeah, I could do a talk. Yeah.
Yeah, well.
Yeah, I could. And I don't know if Milo runs across that or not.
Well, I do run across that, but the way that I deal with that is I don't ask my clients to talk to management companies. I talk to them for them. And I that's why I try to make sure I get So I make sure that I get an application from them so that I can have the interactions with the management company. And then when I go to them, but when I go to talk to my client, I have a positive thing to tell them that these people want to talk to you. They've seen your application, they know your situation, and they still want to talk to you. So that's how we try to have negativity.
That's great. So we have a question in the chat from Lynn Luther saying the vouchers, when she was on Section 8 looking for housing, she was able to take her voucher out of the county if she had housing out of the county. Do you know if that's still true? And will it be true for the new ESG vouchers that are coming down?
I don't know the answer to about the new vouchers, but I know that with this typical Section 8 voucher, as long as the receiving county is willing to take it and Sonoma County is willing to give it up, it has to be a reciprocal type agreement, I think. Then yeah, but yeah, it has to. Both of those agencies have to agree to that transfer.
And have you have experience doing that? Is that hard to do, or is it pretty pro forma?
I've had people that have gone from Sonoma County to Lake County.
Uh-huh.
And that has worked.
Okay.
I think Teddy has some information in the chat about that.
Yeah, I'll send it. I'm reading the FAQs. It says the normal portability procedures and requirements generally apply to EHVs with the following exceptions. And there's something about the head of household and who gets designated that way. So I can send you this too, Adrian. I'll just email it and you can get it out.
Yeah, that's great. I'll send it on to Andrea. My question for you, Milo, is when you run into someone who's homeless, how much assessment do you do for, like, can they make it in a house? Can they make it to talk to the landlord? Do you just take everybody who wants help and try to help them, or do you kind of categorize people right up front?
No, they go through coordinated entry, and then the caseworkers talk to them first, Jennifer and Sheila, who I work with, and then they determine whether or not they're appropriate for rapid rehousing, because they have to have enough income and so forth to be able to pay rent and that kind of thing. And then after we get past that point, we have to make an assessment of, are they capable of actually talking to a landlord and getting a house? And then sometimes you have to coach them through that, because some people will have issues with, just inappropriate utterances and stuff. So we have to just work with them and talk to them on a regular basis and say, don't tell your landlord that you have a bad temper,
Yeah.
You don't want to lead with that. And, things like that, we just kind of, and you get that sense of talking to them over time. And especially the process of filling out the application. That's crucial, because I ask them about things that I see on the application, like, why did you leave this place? And so forth and so on. And then you kind of get a sense of how they're going to be with a prospective landlord. You try to just prepare them for kind of things that are going to preclude them from getting a house.
Mm-hmm.
So it's just a matter of getting to know them.
So it sounds like you have managed to house some people that many of us might wonder if this person will ever be able to please a landlord. Is that true?
Up to you, yeah.
That's really encouraging. Really encouraging.
Well, it's a double-edged sword, because some of the people that are in question, they weren't able to sustain that. So I got them in there, but then they got themselves out pretty fast.
Yeah, that happens.
Right.
And Tim, maybe this is more a question for you, but it sounds like West County has some money to help landlords with the initial repairs and or some problems that come up. And what kind of a fund is that? How much money does that involve?
So it started with our rapid rehousing program, right? That we were doing, they used to be called 1 and 2, right? People who were at risk of homelessness and people who had recently become homeless. And so we just put it then to our proposal that we're going to have funds to help. And there wasn't any problem. I think this was like 2017, maybe, to help with moving expenses, et cetera, et cetera. But then we have what we call a crisis support fund, which Kaiser St. Joe's Individual Donors Fund, that we can use for any purpose that we deem a crisis. Someone who's being beaten by their husband, we can put them in a hotel for 3 days. Kids who don't have shoes at Monterey School, we buy them shoes. Comes to a case manager like Milo mentioned. And so if the rapid rehousing program or Milo needs $600 for X to rent a truck to move somebody, or for a mattress or something that's not covered by rapid rehousing, we can do that.
And can you tell us, in general, like over the course of a year, how much do you need in this kind of a fund to pay that kind of?
So we try to limit it to $500 for an individual or $800 for a family. We increased that during COVID from 300 to 500. We went from 500 to 800. And occasionally we pay 2,000 if we think it merits it. I think, I don't have the spreadsheet in front of me, but I think we've helped like 190 people in the past 3
Wow.
years. So that would be maybe 50 or 60 people a year. Sometimes it's a family of 6, sometimes it's a single individual. Sometimes it's $35 for gas. Sometimes it's, as I mentioned, $2,000 for a car repair so they can go back to work. But usually it's between $500 and $800.
And you get recommendations from your caseworkers. I assume that's where they sort of send you a request or send some management person a request.
Yeah, we have a form for that, and sometimes the school calls or West County Health Centers. They have their own fund though, or River to Coast Children's Services. But we try to tie it into a case manager. They don't do heavy case management on it, but they're working with Joe. Joe's a senior, and Joe lives in a trailer. And Joe's, the roof to be caulked on his trailer because it's raining inside. And Joe makes $900 a month, pays $500 rent. He doesn't have the $700 to get the roof caulked, so we'll do that.
I got it. Thank you, Jerry, and then Gregory.
Yeah, so I want to connect the dots. Share Sonoma County has a similar fund, a client resources fund that's funded by the Vintners subset of the Community Foundation, and there's a lot to be said for that. And Tim, you just mentioned that West County Health has a similar fund. I again think that we need to capture this and show how this little piece of flexible money is actually what is something that ties with rubber bands, ties together situations. So like where somebody needs a motel room or somebody needs a specific, like a new battery, new tires, all those kind of things that we have. And then I mentioned earlier on the chat, season of sharing. That's the purpose of season of sharing. And there's really specific rules, but it's important that we show ourselves and the powers that be how these flexible funds that can be used between the silos of funding often are what literally holds the thing together. And also it's where we need some flexibility when all these allocations are made so that the money can be spent. The big money, the rapid rehousing money, et cetera, can be spent more effectively by helping with some little things.
Yeah.
And thank you both, Tim and Milo. I really appreciate what you're saying.
Thank you.
Yeah. Gregory?
And I'm really hoping Ludmilla is listening to this, and I wish all the other COC members, board members were listening to it. In fact, I'm going to try and send them this tape. This is exactly what the conversation around ESG-CV, the remaining $2 to $3 million, should be spent on. It's about getting these 284 people that we're going to try our best to get into the system and get vouchers need in order to find places and stay in those places. If the COC doesn't see that, it's going to be the biggest mistake they've ever made.
So
That's
Milo,
what fell apart.
I've got a question for you, Milo. Do you obviously already have networks and you're very competent in what you're doing, very skilled, and now you've got all this experience, but are there other people around the county who could do your job? Do you feel like there's like a pool of people that we can hire to help with this project of getting more people into housing?
Well, I think so. It's just a matter of whether or not they're willing to do it. We got to appeal to them to get involved, because the obvious people would be people like me that are real estate agents that know people that have places that they want to rent out and that they, that they could do that. So, they've got to be willing to take time to do it. That's the issue.
So Last question for me. How do you get through people's racism when you interact with a new landlord? Do you have any tricks or ways you deal with that?
Not really. I mean, it doesn't necessarily come up when I'm dealing with landlords. I usually talk to landlords on the phone and initially, and then eventually I actually may meet them, but really their interaction is going to be mostly with the client. So hasn't been an issue for me.
I'm glad to hear it. Thank you. Anyone else for Milo? Anything else you want to tell us that we haven't thought to ask you yet?
No, I think we've covered pretty much everything.
Well,
How do people get referred to Milo?
They go to coordinated entry, which in our case starts with the health center here in Guerneville. You talk to Rosie, and then Rosie refers them to one of our caseworkers, either Sheila or Jennifer, and then they make an evaluation of whether or not they qualify for our rapid rehousing program. And the other way that I get clients is that we have people in the shelter after COVID that have gotten moving on vouchers. And then the people at the shelter refer them to me through Danielle, and then I help them. And we have another pool of people that we have in Park Village in Sebastopol that have gotten moving on vouchers for various reasons. And so Pat.
So you're not limited to West County then?
Yeah. Well, I am limited to West County. I mean, they have to be in our programs for me to help them.
So that's what I'm saying. You won't take any referrals of people that aren't in West County.
Correct.
Right.
Thank you.
Okay, Gail, Kathleen, and Gregory.
If you get somebody that's not in West County appealing to you, who do you refer them to?
Depends on where they
Santa
are.
Rosa.
It depends on where they
Say
are.
they're in Santa Rosa.
If they're in Santa Rosa, I usually refer them to Catholic Charities or Cox and those kind of people over there.
Do you know if they have a program like yours?
I don't know about any other programs like this, no.
Kathleen?
Yes, thank you. One question for Milo. You are doing marvelous work. Do you mind if we try to clone you?
It's been done before, it didn't work.
Weren't there supposed to be a lot of housing navigators funded
More
through this?
people like Milo, sorry.
Yeah, Teddy, I think the answer is yes. And I can't speak to, and maybe Milo, are you familiar with your peers and other agencies?
No, I'm not. And I know that most real estate agents are not interested in doing it.
Yeah.
That's the issue.
No.
COTS and Catholic Charities and others, they do have on paper housing navigators and housing locators. And I can't speak for each of them. Some of them may be great, but I don't, I know some of them do just, hand you a list and say, go get them.
Yeah, no, that is not even, it's not even close to what Milo's doing.
No.
And it's not the function of a housing navigator as they might be funded.
Gregory?
This is a movement that's starting with Milo. I mean, basically, he's probably
That's
one of the
ridiculous.
best of what I've perceived in the county as counselors that move to, locators to navigators. It is something everybody's gambling right now is going to help solve a lot of problems. And my opinion, Homeless Action, for SAVE's development, for COTS, for everybody, need to build this group as a cohesive, communicating group so they can learn from each other and so we can learn from them. I'm willing to do everything I can to be able to have money available to hire them, but we need to be able to connect the dots. We need them to be communicating with each other, learning from each other, and sharing with us the problems they're having. Because
and a lot of plagiarizing of the other organizations.
Absolutely. That's how we built everything. And we're the ones who have the most, I think, to lose if it doesn't happen. And for our clients and for the people on the street. The only other thing I was going to suggest is what you've been hearing is in this pool of housing, we've been very sensitive to the fact that It's a whole lot easier to take someone who's already in a rapid rehousing or in a move on or in something that they're not quite out on the street. They're in something to another place, okay? That's not the intent of either the emergency housing vouchers from the federal point of view. At risk is just a add-on. It's not a central. So I'm worried about people who us and everybody else is dealing with who are not in a permanent place, who have to be tracked down to get the kind of information and to work with them. They're not easy to deal with. They're the hardest to deal with because the intent of all of the work of the Coordinated Entry Committee, as Kathleen knows, and others, is to deal with chronic, long-term, difficult, vulnerable clients, not the ones that are easy. I won't say they're easy in rapid rehousing, but relatively easier than those who aren't. And I want to make sure that we don't miss all of the primary ones because we find it easier to do the others.
Yeah, hear, hear. So Tim has had to leave the building and, oh, Ludmilla, maybe you have a question or something you want to talk to Milo about?
Yeah. So, well, one of the things is that now I don't think I saw like a funding application come through from West County, that covered, for covering that type of thing. Now, maybe I'm not remembering right, but one of the things that I have a concern about is how to open it up so that because I see that Catholic Charities is able to apply for those funds and has applied for those funds for navigation and housing people, but I'm not seeing it clearly with other providers, and I don't know how to have the county open it up. So I'm just curious. Milo, are you being funded through the ESGCV or how is that working?
None of those acronyms mean anything to me.
Okay.
I don't. You'd have to ask Tim those kind of questions.
Okay.
How long have you been working for West County, Milo?
About 4 years.
So the answer there, Ludmilla, is whatever his funding is, it predates the funding you're talking about.
Right.
And just so you know, Milo, Ludmilla sits on the board of the Continuum of Care, and they make money decisions who gets contracts for some of this federal and state money.
Well, one of the things that's happened over those 4 years is my hours have fluctuated between like 24 to 40 hours a week, depending on what the fiscal situation was. But I'm not really privy to all of the mechanizations behind that. I just get told how many hours I can put in and
what they could pay you for. Yeah, it could be that it's partly their general fund, which they raise by donations and so on.
Awesome.
Milo, I've heard several people now talking about how your work is a model, a role model that we want to, clone and all. And then Jerry Longberg suggested that you write us an essay about it. Is that something you're interested in doing?
Sure. Yeah, I can give you a summary about the way I'm not a writer per se, but what I can do is I could write it up as like a standard operating procedures, like how I would, walk you through how I would deal with the client from A to B.
Excellent.
And with Tim's acquiescence, Milo, I'd love to co-edit that with you or help between the two of you and me. We could edit something that meets what I was suggesting.
That would be helpful.
Tim has my information.
Yeah. Okay.
And Milo, I want to introduce you to Andrea, who is one of the pictures on the stage here. She just got hired at Saves to be our outreach worker. So you'll probably run into her here and there. And I saw her taking notes as you were talking.
Okay.
Yeah, I mean, I was going to say, if it's okay, I wanted to know if there was a possibility of shadowing you.
Well, sure. I mean, yeah, I don't know exactly how that would work because I mostly work from my house, and it's mostly just phone work.
Yeah.
But maybe I could.
How about some Zooms?
Yeah. I mean, we could have a regular communication. Tell you how I'm doing things and kind of keep you apprised.
Yep.
That's great. Ludmilla again?
Well, yeah, so do you have enough staff or time or hours to do what you're doing, or are you limited at this point in time?
Yes, I have enough time to do what I'm doing.
Okay, so you've got the support that you need to do what you're doing?
Yes, I do.
And okay. And do you think that there's more people needed in West County doing this, or like, I mean, with more support, you could be reaching more people or more landlords?
Well, like I said before, the housing stock is limited. So throwing more people at it is not necessarily going to change the situation.
That's why, I'm asking, yeah.
Yes, we just have a limited amount of landlords that are available. But I mean, the one thing about having more people is if, it increases the network of people that they know, because they know people that I don't know, obviously. So that could help, in that sense. But as far as just reaching out to landlords, I don't see how it could really make much difference.
Okay.
Yeah, I don't think you were here, Ludmilla, when he said that about 20% of the housing market might be available to people, our clients, our people we want to help. And even if we could get all those 20% of those units, that would still only house about half of the people that need housing. So there's a real deficit, which, is no surprise to any of us in basic housing.
That's why we have the situation that we have. There's not enough housing.
So that's the other thing that we're always fighting for at the county and city level to get more housing built for low income people. Have you ever had any, or what's your interaction with Penn and some of those project type things? Do you work at getting people into those?
I have worked I've never really gotten anybody into Burbank housing, but I know people that have gotten in, and it's mostly from their own, very hard persistence to get through all their bureaucracy. But yeah, I do know some people that have been housed that way, but I haven't successfully gotten anybody in there myself.
That is a really sad commentary.
Yes.
Because you obviously are really good at what you do, and that just shows how close that whole institution. And that is the biggest source of low-income housing in the county.
Yeah, and it's very very difficult to navigate and very competitive.
Very competitive, yes. So I see three people who've been talking a little bit. I guess I'll call on Kathleen because she hasn't talked much, and then I'd like to encourage some other people to talk. Kathleen?
Yep. Thank you. I have a question for Milo about what we're looking at in COC and coordinated entry. I sit on the latter committee, and with these 300 new housing vouchers that have to be used by October 31st. So given the housing inventory and your experience, what is your projected estimate on the success of finding 300 places for people to go?
I would say it does not look good. I'm having problems. A lot of the landlords have very negative attitudes about Section 8. So when I approach them and I send out my inquiries, I'd say a good 50% won't respond, and then another 20-30% respond very negatively, and then the remainers, are willing to talk to me. So I don't think that having more vouchers is good, but I don't think it's actually going to solve our problem, because the problem really is we need dedicated housing for people that are homeless, and it has to be. I mean, because there's, in my experience, there's two categories. There's the people that are just down on their luck and that are by circumstances have caused them to be homeless. Then there's other people that are homeless because they have severe issues, either substance abuse or mental issues and those kind of things. And those people are really, really difficult to house. And so there needs to be dedicated housing for them with on-site caseworkers to help them. Otherwise, they're going to ruin that house, whatever you put them in, because they have issues that they can't handle. So that's what we need. We need dedicated housing that serves those two communities.
And
Could you
that's
put me back?
it's called permanent supportive housing.
Yeah.
And there's not enough of it, obviously.
One of the terms that's not in vogue these days is transitional housing, but there needs to be some place where people can go to learn how to live inside.
Exactly. Oh, we need this. We need this testimony. This is something that coordinated entry and COC absolutely need to hear right now. They're all a flurry. We're spending hours and hours and hours and hours about how these 300 vouchers are going to be split up and who's going to do what. They can't see the forest for the trees because they're not looking at the big picture.
So, if I could recommend, if I can make a recommendation, write Tim, ask him if he can ask Milo to come to one of your meetings and give a little report and make these kind of statements, because they're open meetings. And it probably wouldn't take a whole lot of your time, Milo, to show up. And I find you really compelling.
Absolutely.
In terms of what your experience is.
Yeah. They have actually mentioned, but they really don't want to talk about the fact that a lot of people weren't pre-prepared to be housed successfully right from the streets. They just mentioned that, but there's no work being done about that. And the other, of course, being the lack of units, and that they're simply not looking at this stuff. And I don't know what the solution might be other than for a whole lot of very immediate transitional housing, like more Gillicos villages. But the people who are supposed to be in charge of this aren't looking at the big picture. And no wonder this program has failed so often in Sonoma County. It's heartbreaking.
I believe that the state of California actually has the facilities to actually solve this problem, especially in Sonoma County, because Sonoma Developmental Center is sitting there empty.
Yes,
I know. We've talked about it, and Susan Gorin, the supervisor whose district that is in, absolutely refuses to entertain the idea. It was mentioned a couple of years ago, and very, very strong.
Yeah.
And she absolutely won't hear of it, and they want to make a commercial endeavor out of this and this and that and the other and blah blah blah, and they have turned it down.
Well, those type of facilities are what we need. Places where we can set up transition housing and get people used to living among other people inside, and those are the kind of places that we need.
Yep.
The living room has those.
Yeah. So Teddy and Gregory, I see your hands. Would you communicate in the chat, because we have 10 minutes left, and I want to call on.
Could you put me back in the queue?
Yeah. Oh, I'm sorry, Victoria. Yeah, let me call on you next, Victoria.
Okay, I wanted to know if Milo thought that, and Tim thought that there would be any legislation such as something to give landlords an incentive to, it sounds familiar. It seems like there was one before, or there's one that isn't working. I don't know.
There has been some
I think
programs,
that's something we could
Victoria.
really be behind.
I think the city of Santa Rosa had a landlord incentive fund, but I think it needs to be heftier. So let me call
we
on,
need to maybe push something. That's something we could push.
yeah.
Well,
let me call on Lynn, because she had a suggestion, and I'd like Milo to comment on if he thinks it's a useful one.
Unmute. There we go.
if there could be a little training, because I know all Section 8 holders, at least for me, we were given this little, like a slide presentation of how to seek housing. But if there could also be another little training for people who have not been housed for a long time, to get a training in how to be a good tenant.
Mhm,
It seems like
Yeah.
that's a life skill that people need to learn.
mhm.
You know, especially if they have
Don't complain.
Do you think that's,
Well, sometimes
I'm curious, Milo, about this. Do you think it's useful to try to do this in a group, or do you really think it really has to be one-on-one kind of work?
For prospective tenants?
Yeah, like what she's saying, a training of how to be a good tenant.
Well, I think that the problem, like I said before, the two communities, you got to think of the two communities. There's one group that, they've been housed and they are, their circumstances of what got them in trouble. And I think they'll be very, receptive to that kind of thing. The other group, like I said, they have issues with substance abuse and mental health. So I don't know that their attention spans and their ability to absorb information is going to be effective for them to be trained that way. So I think you got to figure out what individually they need to be able to reach a baseline of, how to interact with other people, and then go from there. I mean, it's like, it's just, that's a different situation. Training them in a group is probably not going to work because they're not really going to listen to you.
Yeah,
Exactly.
that's good. Cynthia, and then I'm going to call on Eileen. Cynthia, I'm calling on you because you haven't spoken yet, and we want your wisdom. So wrap it out for us.
All right. Well, two things. I'm looking at very carefully Safe Parking Operations Manual, which has given me a lot of questions and thoughts. But I'm wondering if what about a municipal tax for landlords that's specifically to fund transitional housing? Any thoughts about that?
Well, who's gonna propose that? Where's it gonna come from? From the state or the county?
Well, if it's a municipal tax, it seems to me it should come from the citizens. Like, for example, a group of us would go to the city of Sebastopol and say, although it would make more sense to do it countywide.
Okay, well, the thing that I would say is for our prospective agencies, the people that are involved here, we do not want to be the ones instituting taxes on the citizens of Sonoma County. We don't want that to come from us because that's gonna destroy our ability to interact with these landlords. It needs to come from somewhere else.
I see.
So we don't want to be the ones advocating that, even though we might think it's a good idea. And I do think it's a good idea, but it needs to be grassroots. It can't be us saying, hey, we're the agencies that are helping homeless people. We want a tax to help homeless people. That's going to alienate landlords like you won't believe.
Of course.
The only thing that I think is going to help us if we want to actually get these Section 8 vouchers to work is there has to be more monthly income for the landlords. That's the incentive that we can give them that'll change their attitude, because that's what they're working on, is they're trying to pay their mortgages, right?
Yeah.
So if we can get them more monthly money, then I can sell that to them. But if I what I'm doing now is I'm trying to sell them on the Section 8 voucher, which is a limited amount, we all know what it is. And then I'm gonna give them an incentive of a couple $1,000s to fix their place or whatever. But that's not really solving their long-term problem, which is making their mortgage. So if we can have something that supplements those monthly payments, then we'll get a lot more landlords to buy into our program. And that's about the only way that I can think that would work.
Oh, thank you so much, Milo. And thank you for all that you do.
Alice, next. You haven't speak.
Thank you. Two things. One quick tip that I learned from somebody that helps is to always pay the rent 2 weeks early. Makes property owners very happy. And the second one is to I was just so impressed, Milo, with your work. And if you and Jerry Lalonberg get together and write this up, perhaps you and Jerry could put together a PowerPoint to train other people to do the wonderful work that you're doing. Thank you very much.
Thanks, Alice. Very good. Eileen.
Well, I just wanted to well, this way anyway. Am impressed and thankful for the new people we've met here today. And the other two things, which totally separate from this, are that we finally got our garden hut installed permanently last week with Harold and Olivia came over here and people from our own community garden. So that was great to have that done. And he's changed the name from huts to hugs, Harold's Utilitarian Garden Shed. So, and the other thing is to remind people that this is the last week for June Michaels running the St. Vincent de Paul dining room. And I did write a email to Jack Tibbetts. I haven't heard back yet. And the last time June Michaels talked with Catholic Charities, they weren't too open on what the future will be. So we'll find out or not.
Yeah, and for those of you who haven't been with us for years and years, the huts that Eileen's talking about are these sleeping shelters that we built, 12 for homeless people. And after about a year, the fire department shut us down, saying there wasn't sprinklers and exits and all of that stuff. So now they've become garden sheds around the county for low income or other good projects. Andrea, I saw your hand up a minute ago. Did you still want to say something? I think you're muted.
Having a little technical difficulty over here. I just wanted to say ditto everything that Milo said. The second group of folks that he's talking about that are difficult to house, they need a tremendous amount of support. It's not about just getting mediation between them and the landlord. And I don't know what the solutions are, but transitional housing for sure, if you can even help them accept that.
Mm-hmm.
Yeah, thank you. Anita, you haven't spoken yet. Are you available? I think, oh, there she is. You want to say something, Anita? I think she may be coming in on. Okay, so a little moment of silence to close out our meeting. That's always healthy and happy. I'm going to stick around for another 5 minutes if other people want to talk about whatever they want to talk about. And I just want to thank Milo again for coming and for all the work you're doing. It is really encouraging and validating to hear what you're doing.
And
Milo for president, yay!
I want to thank you guys for having me at your meeting, and thank you for all that you're doing as well.
Oh, you're welcome.
Thank you.
Yeah.
So,
Before
I
you
really,
end the meeting,
I really do want to say to invite specifically Milo, but and everybody else to this Wednesday's COC meeting at 1 o'clock. Please do speak. Please do comment on stuff. Milo, I would love you to come in and say anything you want there at that meeting at some point.
Where is that meeting?
Oh, on Zoom.
On Zoom. Okay.
Yeah, City of Sonoma County will website COC will has the meetings listed, but the monthly board meeting is this Wednesday. I'd love for you to see, how how that goes. And I'm sorry, I don't know the agenda items off the top of my head. But if there's anything you'd like to speak to there, please do. They allow 2 minutes for public speakers on a variety of topics on each of the agenda items.
Okay.
Yeah.
All right, I'll try to make that.
Yeah, thank you. And thanks you, Ludmilla, for getting that announcement in. It is a pretty important place where major decisions get made by people who sometimes know what they're doing and sometimes don't. They really need a lot of more input by folks like us. And thank you all for coming. Another Monday.